Good morning, my name is Vicky. Today I will be presenting on Dyop virtual acuity testing, a modern digital instrument used in the eye examination. Visual acuity is one of the most essential measures in eye care because it reflects how clearly a patient can see. Traditionally, methods such as the Snellen check or the Logma check has been used. However, these methods are not always precise, and sometimes patients memorize the letter or struggle due to language barrier. With advancements in technology, digital testing methods like Dyop has been developed to improve accuracy and efficiency. Dyop stands for Dynamic Autotype. Unlike traditional charts that use letter or symbol, Dyop using a moving segmental ring. Patients need to identify the direction of rotation, either it's clockwise or anti-clockwise. It is movement-based rather than language-based. It is more objective and suitable for a wider range for patients, including children and those who may not able to read letter. The principle of Dyop testing is based on movement detection rather than symbol recognition. The patient is shown two targets on a digital screen. One is static and the other one is segmental ring that's spinning. The task is to identify which target is moving. As the size of the rotation target getting smaller, the movement becomes harder to detect. The smaller spinning diode that the patient can still recognize represent their visual acuity threshold. This method aligns closely with the psychology of our eyes, since our visual system is highly sensitive to motions. By relying on this natural ability instead of reading symbol, Dyop provides a more objective and accurate measure of visual acuity. Let's explain how are we going to use the Dyop. Dyop testing is performed using a screen at a fixed distance from the patient. Two Dyop circles are displayed, one spin, the other stays still. The patient is shown the rotation ring and asks of the rotation and the direction. The optometrist then reduces the ring size until motion is no longer detectable. This makes Dyop perfect for young children, illiterate patients, patients with language or communication challenges. The Dyop test uses a spinning ring made up of gap and segment. As the ring gets smaller, the gaps also get smaller. When the gaps are too tiny, the eye can no longer tell the direction of the spin. The Dyop acuity endpoint is the smaller ring size where a person can still see the spinning direction. This point shows how clear the vision is and how well correction is working. For 6/6 vision, the smaller visible Dyop ring has a diameter of 7.6 arc-minutes. Its gap area measures 0.54 arc-minutes. Anything smaller is called Dyop subacuity, where the spin cannot be detected because the gaps are beyond the eye's resolution limit. Here are the major benefits of using Dyop. Reduce the chance of patient guessing and memorizing the chart to avoid over minus or under minus reflection. Shorten the examination time per patient. Less tiring compared to letter-based chart. More accurate in borderline or difficult cases. Based on the research done, Dyop maintains a high level of accuracy and precision, approximately plus minus 0.06 diopter. Avoids language and literacy. Dyop makes eye tests more efficient and inclusive for all level patients. Dyop also has some technical advantages. It provides objective measurement rather than subjective letter reading. If given consistent result even after multiple trials. All of this make it a flexible tool for modern clinic and remote setting. It can be integrated into teleoptometrists and mobile apps. It is useful for both vision screening and reflection. However, Dyop is not perfect. It is a new technology, so it is not widely used or adopted by clinics or optometrist practice. Patients need a proper explanation before the test, especially elderly patients. May be also confusing for elderly patients or first-time patients. It requires a digital screen or apps, so it may not be suitable for all environments, especially in areas which have limited access to internet and electricity. Some optometrists still prefer traditional charts, which they are more familiar with, but as technology becomes more common, these barriers will reduce eventually. In summary, the dynamic autotype Dyop is a modern vision test that using spinning ring to check how well a person sees motion and its direction. The smaller spinning ring that can still be detected show the vision clarity. The advantage is faster and more accurate than traditional charts. Works well for children and non-verbal patients. Give more consistent results than standard or normal charts. The limitation is some patients may find the spinning ring confusing or tiring. Not yet widely used by optometrists as the main test. Future potential could become a standard tool in optometrists. Useful for remote testing like tele-optometrists and online exam. Seen as a possible modern replacement for the old letter chart. Thank you.